Thank you. This will be our last question before we move on to closing statements, so I just wanted to mention that before I offer it. But Mr. Hickman, we'll start with you. What do you feel like is the most pressing issue for the 4th Senate District? Because it is very diverse. Our counties they look very different demographically, economically, just very, very multiple ways. So what is the most pressing issue for our district?
Well, I think you're referring to after the COVID-19 crisis, that we get ourselves back to some type of similar normal, which we will never be back to our normal that we were before. I think the most pressing issue for our district is economic development. And as I stated earlier, I really believe that economic development is like a three-legged stool. With the seat being economic development, with each leg of the stool, one leg being education, one being transportation, and one being healthcare. We got a great education system throughout our district, great private schools, great public schools. We're turning out kids that are able to go to school anywhere they want to go to now. In all the big schools, our kids can be accepted. The problem is they don't have opportunities to come back here. I want our children to have an opportunity to come back to our district and work if they want to. If not, I don't want to stay in Atlanta or New York because there's no opportunities here. We also need to make sure that of that stool, as I said, with education, the second leg of that stool has got to be health care. We've got to have health care access to all citizens in every district. And it's got to be great health care. Nobody wants to move into an area that doesn't have good health care. And we may have some issues with that now in our district. So that's the second leg of the stool. The third leg of the stool is transportation. We've got to have adequate transportation system. People have got to be able to get in and get out. Big trucks have got to be able to get in and get out. So my platform is economic development. I want to grow our district. I want to grow our agriculture, and through economic development, we can bring in some manufacturing plants that deal with agricultural products, which is the #1 industry in our state. So growing our district, growing for jobs, having kids have the opportunity to come back and work here. That's my #1 priority. Thank you.
Thank you. Dr. Golke?
So certainly at this present time, the healthcare is my main, I think, one of the biggest issues right now in this district. Certainly coming out of this virus pandemic, as we have noted, is near and dear to me, but certainly near and dear to this district. People all over this district as well as the state, the #1 issue is concern about the virus. We need to be better testing. I need to have the testing in my office so I can tell a patient within 10 or 15 minutes if they're positive or negative. We need medicine. We need a medicine to treat it, as similar to the Tamiflu treats the flu. And then lastly, we need vaccine, and that will help. Once you get to 70% of people either exposed or through a vaccine, we'll be through this crisis. After that, certainly businesses. We have to get everybody back working. Certainly with these things in the healthcare industry would help them get working. I'm looking at rural broadband. We need to get our district rural broadband. That everybody knows, and with the education and having students access to their ability to get their education online, and also for the business to work. I'm very fortunate in Brooklet because we have bullet telephone, and they are fast as they do a wonderful job. And that helps me because my electronic medical records are on a cloud-based system. So that is very, very important as we move forward too as well. So I think this is a very diverse district, but we have lots of issues that we need to address. But once again, I think the two biggest at the present time are the business and healthcare. Thank you.
Thank you. Mr. Singleton?
I believe, just to really piggyback off everybody else, it's economic growth and healthcare, but healthcare is going to grow if we can start the economy back up. What we need to concentrate on is bringing telehealth and telemedicine into this district. And to piggyback on the broadband, I've been with on companies for 6 months about expanding broadband in rural Georgia. In my county alone, 50% doesn't even have access to internet. Where I live, I don't even have access to cable. My internet is just my Verizon telephone, and that sometimes that doesn't even work. So I think when it comes to healthcare, we need to really look into telemedicine. It's the future. It's coming. It needs to happen. It can keep the elderly at home, where we have nurses aides coming in and helping them with those programs. There's apps that will monitor patients who can't leave their home or patients who don't want to leave their home. They can wear a wristband, and the doctors can see their stats. And I mean, just like that. It's actually cheaper on an average rate of $79 per visit, and Medicare is now covering it. Full cost, no cost to anybody. Doctors get paid, patients don't have to pay. So healthcare is one of the most important things. We've got to build the economic growth, and we've got to get into the future of telemedicine. It's not scary, and it seems that everybody wants to scare away from it. That's the future. We got to get in on it.
Thank you. Ms. Palmer?
Thank you. Economic development, including the economic development across the agricultural business in our Senate district, is going to be key. And one way to be certain that that can happen is to keep a very close eye on the budget. We are going into a series of finishing up this legislative session with the last 10 days of the 40-day legislative session for this year, for 2020. With no budget yet, we've got to pass that budget. It's got to be passed constitutionally by July 1, as we have to have a balanced budget. We have got to keep our eye on that budget. If we want economic development in Senate District 4, if we want health care in Senate District 4, if we want the broadband with all the grants that have already passed, the grant opportunities, the broadband bill has passed. Now, if we're going to get those grants, we have got to keep our eye on that budget. We cannot let any of the money destined to come to Senate District 4 slip away from us. It is imperative that you have a strong advocate in Atlanta who can monitor that budget, be certain that the money comes to our part of Georgia so that the economic development opportunities, the agricultural opportunities, the healthcare opportunities happen. Also, we've got to be very certain right now that our people are counted in the 2020 census. For every person in our district who is not counted, we will lose $1,700 a year for the next 10 years. We have got to step up to the plate and get our citizens counted so that we will have the money coming to our district that will be our fair share and will allow us to provide for education, for road development, for economic development, for agriculture, for all of the issues that need to be addressed. Let's keep our eyes on the money, because it's the money that